One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidneys start to thicken in order to withstand the pressure, and that results in a narrow lumen. A narrow lumen means less blood and oxygen gets delivered to the kidney, which leads to ischemic injury to the nephron's glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta-1, or TGF-beta1. These growth factors cause the mesangial cells to regress back to their more immature stem cell state known as mesangioblasts. And then those mesangioblasts secrete extracellular structural matrix. This excessive extracellular matrix leads to glomerulosclerosis, which is hardening and scarring, which diminishes the nephron's ability to filter the blood. And over time, this leads to chronic kidney disease. The most common cause of chronic kidney disease is diabetes. In this situation, excess glucose in the blood starts sticking to proteins, a process called non-enzymatic glycation, because no enzymes are involved. This process of glycation particularly affects the efferent arteriole and causes it to get stiff and more narrow, a process called hyaline arteriosclerosis. This creates an obstruction that makes it difficult for blood to leave the glomerulus, and increases pressure within the glomerulus, which leads to hyperfiltration, essentially pushing more fluid through. In response to this high-pressure state, the supportive mesangial cells secrete more and more structural matrix, which expands the size of the glomerulus. Over many years, this process of glomerulosclerosis once again diminishes the nephron's ability to filter the blood and can lead to chronic kidney disease. Although diabetes and hypertension are responsible for the vast majority of chronic kidney disease cases, there are other causes as well, including systemic diseases like lupus and rheumatoid arthritis, which can also cause glomerulosclerosis. Other causes, though, include infections like HIV, as well as long-term use of medications like NSAIDs, and toxins like the ones in tobacco.